We need national plans because we need to implement brain plans to know the needs and gaps of the regions of the nations where we want to develop these plans. So we can develop regional or world strategies, but we need to boil them down into the local realities and frames. Since 2022, we have the WHO Intersectoral Global Action Plan on Epilepsy and Neurological Disorders. These put neurological disorders on the map, and since then we know that the WHO considers neurological disorders as a public health priority. Now, if we look back, since 2013 there have been two other activities or two other plans that have been developed at the WHO on mental health and on dementia. So to develop brain plans, we need to take into account these different strategies of the WHO, and to do this at national level, we need to understand the needs and the gaps in the regions where we want to implement these plans. So, for example, in Switzerland, we are collecting data, real data from, our country concerning the burden of brain disorders, the disability, but also the costs. And this is really what policymakers and decision makers need to be convinced that to develop a national brain plan is important. So you need to know, the reality you want to work on to be able to develop a concrete national plan.